and educate you while keeping you entertained. We continue our conversation here about healthy eating as it pertains to cancer, lifestyle diseases. Joining us on set, we have the Chief Executive Officer of the Caribbean Association for Oncology and Haematology, Dr. Marissa Nimrod. Such a pleasure chatting with you. Even before this interview started, we were having a little conversation before there. So my first question to you, how long has the Caribbean Association for Oncology and Haematology been around?
So good morning. The CAHO, or Caribbean Association, has actually been around for at least 10 years. It was started initially as a project by Dr. Peter Bovell. This was his vision. And then last year I decided to take it over and reincorporate the company and see if we could give it a different perspective.
Do we have any statistics as it pertains to the prevalence of cancer in Trinidad and Tobago, and even by extension the Caribbean?
So we do have data. Colleagues are actually doing research, so we do have some data. As it stands, the registry is normally the particular database or tool that gives us accurate information. That is actually being updated as we speak. So I think we're probably up to 2012. I don't want to quote it correct, but we're still working on it. And you know, CAFA, the Caribbean Public Health Agency, is actually working across the Caribbean to facilitate countries in either establishing one or improving on the existing infrastructure that we have so that we can define what our clinical epidemiology and our numbers would be with respect to cancer and its prevalence or its incidence in the Caribbean. So that's a work in progress, and we expect, you know, hopefully next 5 years we should have accurate data coming out of it. Until then, yeah, we normally would project, you know, different statistical software to get numbers.
Great. Now, another thing, I know we've probably increased in terms of our technological advancements as it pertains to screening, so perhaps the figures may show an increase in terms of the prevalence. But would you say because of the lifestyles that we lead, we're so much busier, we don't have time to do many things, including preparing a proper meal at home. So we run out to fast food outlets and we get something to eat just to fill that space in there or to curb, you know, that hunger. And then we don't have time to exercise. Would you say that these are two main factors, among others, that would contribute to an increase in terms of the prevalence of cancer in our population?
Right. So in terms of those are modifiable risk factors, yes, cancer is actually affected by risk factors. And that's what we try to educate persons with respect to our prevention programs. So diet is important. Exercise definitely is important because we do have risk factors associated, for example, obesity and colon cancer. And obviously, as you said, if we can get the extra exercise in, you know, we can take down those fat levels and pretty much, you know, not obliterate or completely, because patients come and they tell you I've had a healthy lifestyle, but I still develop cancer. But it's really a risk reduction, and that's what we're looking at doing, trying to get the information out there as well as an education or advocacy tool to get persons to understand that you need to take an active part. Cancer, care and control is everyone's business. So you're right. So it probably means taking a little extra time to probably, you know, put your vegetables aside, cut up your prep time, probably on a Sunday if it's available, or trying to find that selection out there from the restaurant or from, you know, particular outlets who offer healthy eating options. So I agree with you. There are things we can do to actually modify those risk factors.
You know, but as humans, let's face it, you know, you're a professional as well. And I'm sure there are times when you don't get that chance to really stop and prepare a healthy meal.
Of course, I can be guilty on that as well.
Even exercise, catching up on exercise. And the thing is, they say, okay, you're working so hard, and then one day you're going to use that said money to pay doctor bills.
That's true as well. So that means probably improving on our time management. We pretty much advocate at least 15 to 20 minutes a day is good for your heart, right?
That's cardio.
Yeah, that's cardio. So you can walk, you can come up with creative things to do, you know, from up and down the stairs, you know, running around your house, you know, things like that. You don't have to go to a gym. And I think, you know, that's one aspect in terms of restriction or access. You know, how do I do these things without, you know, giving time up for my busy schedule? So I think technology has brought us pretty far. You can go on YouTube and find routines that you can do in your office or you can do at home with your family, you know. So sometimes it really just takes a little extra effort or energy to put in some of the things to improve on your quality of life, because quality of life is another indicator that we reference when we're looking at cancer care.
Now, as a doctor, I'd like to ask you this question. What is the impact of stress on the body? What really happens?
All right, so stress is actually complex. There are two types. I normally tell my patients: there's healthy stress and unhealthy stress.
There's healthy stress?
Yeah, exercise is a form of healthy stress,
Oh, right,
actually.
yes, yes.
So I put it
Yes.
into two simple definitions. So unhealthy stress, as you would say, for example, would be burning the midnight oil. So you're going, really late hours. It affects your sleep. It affects your dietary requirements. So obviously, the body is going to is probably going to be affected in terms of its metabolism. So now I'm not eating, I'm not drinking. I'm going to have, periods when I'm getting headaches. I may, have dehydration. So it's going to affect your normal baseline function or your homeostasis that's keeping us in a neutral condition where everything is in balance. So we see stress as a general term as a factor. Yes, it can. So unhealthy stress can, and it can actually lead to other habits, for example, smoking or drinking, as a coping mechanism. So if that's the case, then you try to find something else, to replace it, as you just said. So healthy stress would be exercise. If you can do that, talking to someone in terms of mental health, all these are factors that can be initiated by you or someone if they're actually noticing that something's happened to the person that they know, their baseline, to help improve, because it takes sometimes persons close to you, colleagues, co-workers, to give you the support system. So stress reduction sometimes can become a team event, it can become a departmental event, and I think those are, some of the ways that we can look at focusing on improving the overall individual, from mental health to physical health, and just your overall well-being. So, linking it back to cancer, as you said, it's actually a holistic component, right? And it takes all into consideration. When persons get diagnosed, it becomes a stressful event in terms of mental. Most people think, I'm going to die. And we're here to actually advocate that there are enough resources available, including in Trinidad, from counselors to primary care facilities, persons who you can actually access and reference who would be willing to assist. So we're engaging both private and public stakeholders from CARGO's perspective to be part of this joint event in getting persons to access and not to stay home and probably, mull over it and probably find other ways to treat with coping with your diagnosis, or probably just getting there to find out if it is. Because a lot of times, culturally, persons may think, I have a lump, for example, in breast cancer, and they don't want to know. They don't want to have bad news. So we're trying to engage all persons, especially for this meeting, to find out what the issues are, what are the concerns. Is it something from a cultural point of view where you think cancer is a death sentence? Is it something that you've heard in terms of negative feedback? We want to educate persons that it's not as scary. There's enough data, there's enough evidence, there's enough support systems through the ministries, through partners, to get people to come in and do something about it, because the screening line is normally, early detection, gives you a better overall quality of life, and you live longer, and that's the whole purpose of getting persons into the system.
So this is the 8th conference?
Yes, so this is the 8th conference. So traditionally what is done, the conference is hosted in a different country. It was in Barbados, I think in 2015. We had it last year when we started, so we were really looking at speaking about resource stratifications and optimizing resources, because different countries would have different financial scenarios. So we're hoping this year to deliver something brand new off of last year's conference. We will be developing the first peer-reviewed or peer-endorsed cancer treatment guidelines. So it's going to be the first Caribbean resource-stratified cancer treatment guidelines in collaboration with the National Comprehensive Cancer Network. And they're the gold standards in the U.S. for cancer care. So we were quite honored last year when Dr. Anderson initiated this collaboration with CAHO, and we're hoping to have everyone's voice on board. So 360-degree stakeholder feedback is one of the quintessential points for this meeting. So we're trying to get everyone, and the healthcare professionals, doctors, nurses, lab techs, pharmacists. We want the general public as well, because being a provider, as a medical provider, is one thing. The consumer on the other end may have a totally different experience or reality. So we're trying to bridge that divide and see, when things are planned on one side, what the person experiences on the other side, and how we can actually formulate something that can be adapted to each country that would suit their particular operating system, if you want to put it like that.
Great. Is there a cost to attend it, and what do you get as a registrant?
Okay, great. So we decided to extend the early bird registration this morning until Friday. So it's 150 US per person. For students, medical students with their cards, I think we've put it to 100 US. And that really covers the meals at the Hyatt. So we're hosting at the Hyatt. That's next week, Friday and Saturday. So meals, conference materials, the opportunity to network with persons from across the region, including the US, and to hear feedback from other countries as well. We're quite happy to have the diplomatic corps being represented this year as part of the Declaration of Port of Spain back then. So they're hoping to come and offer, different support systems for their countries, USA, Panama, Jamaica. So we also have them as being part of the divide, as well as the ministries of health representatives from across the Caribbean. So we really want to make this, a platform for persons to come and contribute, because only when we get feedback, then we can probably tailor our particular plan going forward, and to build friendships, to exchange, experiences, and hopefully, to get this membership drive going so we have more of a voice for next year.
Great, thank you. And in our final 2 seconds, is there a number to call?
Sure, it's actually on our website. Okay. You can check the website, Great. Caribbean Association, Oncology and Haematology.com.
Thank you so much, Dr. Marissa Nimrod. Definitely a pleasure chatting with you. We take a short break, much more when we return.